In 1928, beneath the hill of Pachaimalai, a hospital was built. It was once believed that the wind from this hill could cure the sick at Tambaram Sanatorium. But that was before HIV came to India.
We had 6,000 new HIV patients coming to our hospital in 2001, 11,000 patients in 2002, and last year we had 13,000 patients.
Tambaram Sanatorium, also known as the Government Hospital of Thoracic Medicine, is just outside the port city of Chennai. Home to between 7 and 10 million people and South India's center of commerce, it was here in Chennai that the first case of HIV in India was diagnosed. It began in 1992 among commercial sex workers and truck drivers. But it quickly spread, affecting families, children, and people from all walks of life. Today, Tamil Nadu has one of the highest rates of HIV infection of any state in India. But at Tambaram Sanatorium, HIV is more than numbers and alarming statistics. HIV cases are people, with lives and jobs, with families and faces. 5-year-old Victor's family has come to Tambaram in search of AIDS care. Victor's father Yesudas, who also has HIV, is still well enough to work. But both Victor and his mother Jyothi are growing weaker. Victor's grandmother stays on the ward to help care for them. In May 2003, HIV anti-retroviral medications are not yet available at Tambaram. The staff provide what comfort they can, but there is little anyone can offer as Jyothi and Yesudas lose their son to AIDS. While it is too late for Victor, it may not be too late for his father Yesudas or his mother Jyothi. Antiretroviral therapy, or ART, has been called a miracle for those with AIDS. Until now, that miracle has not been available at public hospitals in India. But 6 months after Victor's death, in January 2004, the Government of India announces that Tambaram will be a pilot site for access to free antiretroviral therapy.
Actually, most of us in this hospital were taken off guard, really, because we never expected ART program is going to come so soon.
In preparation for the arrival of antiretroviral drugs, the staff at Tambaram scrambles to set up a space for ART counselling and to develop protocols for managing treatment. While the exact timing of the launch of antiretrovirals comes as a surprise, work has been underway for several years at Tambaram to prepare for this moment. In collaboration with the US Centers for Disease Control and Prevention, Tambaram has been updating its infrastructure, developing everything from reliable power systems to a state-of-the-art laboratory. Even the hospital information system is undergoing change. Paper records are being transferred to computers, giving doctors and researchers quick access to accurate patient information. Of course, successful treatment will require more than bricks and mortar, more than new drugs and new computer systems. It will also require that the staff learn new skills and take on new roles. But for Jyothi and her husband Yesudas, all that matters is that in April 2004, they are among the very first patients in India to receive free anti-retroviral medications at the launch of Tambaram's ART program. With the help of antiretrovirals, Yesudas's health improves rapidly. But for Jyothi, it may be too late. Over the following months, she is in and out of the hospital several times.
இது 3 வருஷம் அது எங்களுக்கு தெரிஞ்சு. அதனால எங்களுக்கு கிளியர் ஆகிற மாதிரி இல்லை. வர பிரச்சனைகள் வந்துக்கிட்டு தான் இருக்கும். ரொம்ப வீக் ஆகிட்டாங்க, முடியாத. அதான் ஊரில் எல்லோரும் இறந்து போயிடான்றாங்க.
Gradually, the care she is receiving and the antiretroviral medications begin to take effect. Jyothi regains enough strength to be released from the hospital. As more patients are enrolled in Tambaram's antiretroviral therapy program, the staff grows used to working in teams. In this new approach, doctors, nurses, pharmacists, dietitians and counselors communicate with each other and with the patients to monitor their health and manage drug side effects. Jyothi has been home for several weeks, but her health remains fragile. Today she returns for a regular checkup.
ஆனால் எங்களுக்கு அதை 2-3 டாக்டருங்களும் நல்லா பார்த்தாங்க. பெரிய டாக்டரும் அடுத்தது பெரிய டாக்டரு பெரிய டாக்டரை வந்து பார்ப்போம். அவர் ஸ்ட்ராங்கான இதெல்லாம் கொடுப்பாரு. நல்லா ஜோதிக்கு நல்லா பாருங்கன்ட்டு அவர் பயங்கரமாக சொல்லுவார்.
We do not have any distinction between he's a deputy superintendent or a medical officer in charge or a pharmacist or a counselor or a nurses. We work as a team. Because we are also moving as a team, patients are also seeing themselves also a family members. When I say to Kuma, வேண்டாம்மா பயமாக இருக்கா, கவலையாக இருக்கா, ஏதோ நாங்கள் கொடுக்க மாட்டோம்மா பயப்படியா? In fact, I have to say, many of the patients coming and telling us, we have all become one family. It is an attachment, a bondage, a linkage, where the people are able to come out of their hidings, really. They come out very openly and expressing themselves, not only with their spouses and family members, but also to the others. It is a very, very welcome change.
பேதி மாத்திரை
கொடுத்துருக்கோம்மா, பரவாயில்ல வந்ததுக்கு நாங்கள் எதாவது
கம் பேக் 96 கெட் தி ட்ரக்ஸ்
இடையில நெல்
ரைட் புதன்கிழமை முடிஞ்சது. ஓஆர்எஸ் வாங்கிக்கப்பா சிஸ்டர், ஓஆர்எஸ் இருக்கா?
இருக்கும் அந்த இதில்.
In South India, the seasons pass, and the festival of Diwali brings its annual celebration of light and renewal. And as for Jyothi, most people in her village have begun to call her renewal a miracle.
டாக்டருங்களே ஆச்சரியப்படுறாங்க. என்னது சிடிபர் 500 வந்திருக்குன்னா உண்மையாக நம்பவே முடியல எங்களுக்கு.
டாக்டர் கேட்குறாங்க, நீ என்ன சாப்பிட்ற ஜோதி? ஏசுதாஸ்க்கு 180 இருந்தது, அவரே இப்போ 449 தான் வந்திருக்காரு. உனக்கு 41 தான் இருந்தது, நீ 500 வந்துட்டு இருக்கிய, என்ன சாப்பிட்ற அப்படிங்கிறாரு.
One more important factor, the ART has contributed a lot in making the patient coming to a center with a lot of hope. They are bringing their children and spouses for a screening purposes earlier with some sort of a hope. That is also increasing the diagnosis of the new patients.
The introduction of anti-retroviral therapy, the partnerships with others to build new facilities, and infrastructure to provide clinical training have given Tambaram a new way of seeing itself. With the help of many, Tambaram has begun to transform itself into a true center of excellence. Its goals are formidable: to train HIV clinicians from throughout southern India, and to serve as a model of how world-class HIV care can be delivered to all who need it. With pride and purpose, the Tambaram staff go to work each day dedicated to the belief that the patients they serve deserve nothing less.
ஊனம் 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 இங்கே ஊனம் யாருங்கோ, உடம்பில் உள்ள குறைகள் எல்லாம் ஊனம் இல்லைங்கோ. ஊனம் 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 இங்கே ஊனம் யாருங்கோ, உடம்பில் உள்ள குறைகள் எல்லாம் ஊனம். ஒத்த காலில் நல்ல வழி நடக்கிறா. ஊனம் 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 இங்கே ஊனம் யாருங்கோ, உடம்பில்